Hi, my name is Natalie, and this is my victim. Her name is Stacy, and we're going to be doing airway obstruction of an adult and child. So, for airway obstruction, it is very similar to doing CPR. The only thing is that we're kind of just looking for a foreign object in their mouth in between compressions. The chest compressions will help with the unlodging of the foreign object that's in their lungs. We of course check the scene for safety, then we go ahead and check for responsiveness, tap them, shout at them. If we know their name, call their name. After that, we stop and listen for signs of life for about 5 to 10 seconds, no more than 7 seconds. And if there are no signs of life, then we immediately go into chest compressions. After 30 compressions, we're gonna do the head tilt chin lift, and we're gonna pinch it up and give 2 breaths. And if we feel the air come back or we do not see the chest rise, re-tilt the head, pinch the nose, and give another breath. If the air is still not going in them, we're going to assume that there is an airway obstruction and continue with another 30 compressions. After the 30 compressions, we're gonna go ahead and look in their mouth. If we see something, we're gonna do a finger sweep once. And after we do the finger sweep, we're gonna do the head tilt chin lift and give 2 rescue breaths. We're gonna go ahead and do another 30 compressions. We're gonna look in their mouth. If we see something, we're gonna do a finger sweep and give another 2 safety breaths till we get the breaths to go in. Once we get the breaths to go in, we're gonna resume compressions and breaths until an AED gets to the scene or until somebody else shows up and helps you out with the compressions and breaths, or until, of course, signs of life are shown. The only difference for airway obstruction for a child is the chest compression depth. For an adult, it is at least 2 inches of depth, and for a child, it is about 2 inches. It could be a little less. And if it is a particularly small child, then we will only use one hand to do chest compressions.